Okay, so welcome to one more webinar. This webinar today, I want to talk to you about certain remedies that we don't use very often. And that's why I like to call it as the old and forgotten remedies. The remedy I want to talk to you today about is sulfur iod. And we prescribe sulfur so often. However, this remedy, sulfur iod, is a very interesting remedy and very practical, applicable. And I've used it in a few cases with fairly good results. So it was proved by Calcil on himself and others. Dr. Hale specifically spoke about its action on obstinate skin eruptions, especially on upper lip and on the chin. So let's start with the sphere of action. Sulfur has a specific action on tissue, on skin, on glands. The way I understand it is, it means that it's special action on the tissues, the skin tissues, the bone tissue, the glandular tissues, and especially it's right sided. It is aggravated by slight exertion, it is aggravated by heat, being sulfur remedy, it's aggravated before storm, it's worse at night, it is better by cold air and standing. Now this is quite opposite to sulfur because sulfur standing is the worst position, while sulfur iode standing ameliorate. So this is how you compare and contrast. The first thing I always look at is Boger. And Boger has spoken about few things. The main symptom of sulfur iode is sensitivity and burning, where discharge is burning, and infiltration. I would use the word chronic infiltration with suppuration, which favors reabsorption. This for me is one of the very important rubric of sulfur. So my idea of understanding a remedy is through rubrics. So I call this as the pattern of remedies, the pattern of rubrics. So I kind of connect different rubrics of the same remedy and understand the picture. This makes the materia medica more larger, more broader. So sulfur, one of the main symptoms is single parts effect. This is written in Phatak repertory, which means that in cases of sulfur, you won't see only one, the entire body affected. You will see only one part affected. See, it could be a strong, thick lichen planus eruption on the hand, or you could see a suppurative lesion only in the rectum. So it will be only single part affected. It has a specific action on the throat. It's a glandular remedy, iodine. You will see glands which are knotted. You will see tongue which is thick, hard, swollen tonsil, aggravated, painful. This is also similar to Baraita iode in that pathological sphere. Parotid often becomes very hard after months. It's a very chronic infiltrative remedy. So all kind of pathologically tissues, it's a kind of a chronic inflammation. So stricture is what will happen in the urethra. It's very well known for it. Gonorrhea. That's why I would put sulfur iode into a psychotic remedy. And I would like to compare it with thuja and medorinum. It has symptoms like Kali Bai, which are yellow, thick, greenish mucus, ameliorated, but hot patient. It also has the most painful, soul aching, painful, tender souls, which is the other remedy in it. Squilla, remember squilla, but standing ameliorate. Another very important thing that I want to talk to about sulfur is that they are the most doubtful people. Doubtful, hoga nahi hoga, hoga nahi hoga. This is opposite to sulfur. Sulfur very hopeful. Sulfur iode very doubting and moist, thick eruptions. Then we come to cravings and aversion. Sulfur iode has the maximum craving for lemonade, the maximum, topmost, and especially craving for sour khatta, sour food. And in Kent repertory, you will see in lemonade desire, you will see sulfur. Even in pickles desire, in sour acid desire, you will see sulfur is the main remedy. This kind of remedy, small remedy in Kent repertory with high marks, this gives me a very good idea about sulfur. Pulford has written specifically that obviously it's night aggravation, but also it is a lot of catarrhal discharges are yellow. Let's go ahead. And I want to tell you an interesting case I had. A case of constriction of headache, very bad headache, a young boy with bad headache with thick eruption of the back. He would say it would be constricting his above head. Pulsation in the temple. Yellow, thick cough with black, thick lichen planus like eruption. And when I looked at the repertory, constriction forehead over eye, pulsation of the temple, discharge thick and eruption acne, even thick eruption. The remedy that I got was sulphur iod, and this remarkably helped. And I was feeling in this case very often. One sensation that often patient will say, one is that headache as if constriction like cactus, squeezed and hair were erect. Now we will come to the state of mind. Now, this is very interesting because I kind of connect the rubrics of the state of mind, and this is a drug picture you will not see in any book. This is something that I have been working on for last few months. So what I have realized is this is the pattern of sulfur where they feel a lot of physical anxiety about something, about especially about themselves, how things are going to happen, and causeless anxiety with restlessness initially, followed by total indifference, total apathy, total loss of desire for work. You can see this in the rubrics, and I will show you some rubrics that you should have a look at. Business incapacity for, absent minded, doubtful, very doubtful, don't want to work, duty aversion to, don't want to go out, going out aversion, doesn't want to do daily routine work, indolence aversion to work usual, even slightest exertion they don't want to do, fear of slightest exertion, indifferent to duty, domestic, indifferent to surrounding, neglects household, mental work excel. So you are thinking of a carbon remedy or sepia-like remedy, but it could be sulfur. You can see this in the repertory very nicely. The rubrics are given. You can have a look here. Clinically, I have seen my guru, Dr. Vijay Vaishnav, he is now based in California. Cases after cases, I have seen lichen planus being cured with this remedy, especially on the arms. Lot of lichen planus with itching. And even you can see Boric repertory has given lichen planus. Pityriasis also. Pruritus, ear, nose, arm, urethra. Phatak repertory has spoken about especially chronic infection of kidney. That makes it a good remedy for chronic kidney disease. Pylitis, urine pus, stricture, suppurative, kidney abscess. Phatak has written the genius of the remedy, obstinate skin eruption, painless enlargement, thickening induration. Other important symptom that you should remember is weakness as from influenza. Interesting. And suppurative, favors reabsorption. Few clinical tips I want to give you which I have seen working very well. Weeping eczema. Sulphur iod is a better remedy than Lazarium. Cough in the morning, cough yellow, thick expectoration, chest tight. When Kali Bai fails, think of sulphur iod. Headache, especially sides, worse binding of head, sulphur iod. Lippy has seen very nice aggravation by slightest exertion. Hansen, tongue thick remaining. So lichen of the tongue or the mouth, think sulphur iod. Relationship, this is very important. Especially when sulfur fails, think about sulphur iod. I also feel that it is very closely connected to medorinum because many cravings, sour craving, hot patient, psychotic remedy. Calcarea fluor is the closest pathological similar to sulphur iod. Infiltration, thickening. So this is my idea about sulphur iod. I'm working on building the drug pictures, the drug picture remedies which we have not evolved, but I'm using very often. Write to me about your thoughts. This is my email ID, gaurang@gmail.com. Thank you for hearing me.